Why did you decide to write this book now?
There's a current shortage of physicians that's only expected to increase in the coming years. Physician assistants and nurse practitioners are going to be increasingly called upon to fill this void. In doing so, we need to be well versed in EKG interpretation, as it represents a safe and effective tool, as well as being inexpensive in the fight against cardiovascular morbidity and mortality. I precept quite a few PA and NP students every year, and I hear the same things from them, that they just don't feel comfortable with EKG interpretation coming out of school and aren't happy with the resources that are currently available. So I decided to write this book and address those needs and hopefully fill that void.
How is your book different than other books on this subject?
My book takes a more physiologic approach to EKG interpretation. I try to explain the how and the why and not just present the facts in EKG interpretation. This really helps ground a more clinical approach to EKG interpretation and understanding and not just memorizing. I also try to teach the reader to correlate subjective findings in what patients tell you with objective findings on the EKG to help achieve a more well-rounded approach to the EKG.
What key messages in your book would you want the reader to grasp?
The most important thing I want the reader to grasp is that they should always take a systematic approach to EKG interpretation. A lot of people find the EKG to be a daunting task to conquer, and a lot of this, I think, lies in the way the EKG is presented and how the reader interprets the EKG. So the most important thing is to take a systematic approach and never leave anything out. I also want the reader to always remember to correlate clinical findings in what patients tell you, what you see on physical exam, and correlate that with what you see on the EKG.